The World Health Organization has reported that the last major operational hospital in northern Gaza has been rendered non-functional after being evacuated by the Israeli military. The Kamal Adwan Hospital had been under siege by the IDF for weeks. Staff revealed that airstrikes on Friday led to the deaths of 50 individuals. The head of the hospital's nursing department told the BBC that the military gave them just a 15-minute warning to evacuate patients and staff before Israeli forces entered the hospital to remove anyone who remained. Israel claims the facility was being used by Hamas as a command center, but has not provided evidence to substantiate this. Let's now speak to our correspondent in Jerusalem, Amir Nider, who joins us live. Amir, good morning. What's the current health situation for those in northern Gaza? Well, it has deteriorated significantly now that this hospital has been taken out of service. This morning, we heard from Gaza's Deputy Minister of Health, who stated that after the forced evacuation of the hospital yesterday, around 100 staff members were taken for interrogation. While some have since been released and recounted a harrowing night of questioning, others, including the hospital's director, Dr. Hossam Abu Safia, are believed to still be detained. Those who were released have reportedly moved to a nearby hospital, itself evacuated earlier this week by the Israeli military, which had proposed it as an alternative location for patients and staff to continue their work. However, staff have said there is essentially no hospital to operate there. The Indonesian hospital lacks running water and electricity, leaving acute patients, particularly those reliant on ventilators, in critical danger. The World Health Organization has expressed deep concern for these patients, emphasizing that the Indonesian facility cannot meet their needs. The Israeli military, following its clearance of the hospital yesterday, alleged that it was being utilized by Hamas as a terrorist stronghold, a claim Hamas denies. However, the health situation in northern Gaza is now at a crisis point, with the last significant medical facility no longer functional. Thank you, Amir, for the update from Jerusalem. Now, let's hear from Dr. James Smith, an emergency doctor who has visited Gaza twice in the past year to provide critical care at hospitals, including Kamal Adwan. Dr. Smith, thank you for joining us. You're in contact with colleagues in Gaza. What have they shared with you? Your correspondent's account is quite accurate. We lost contact with the staff at Kamal Adwan yesterday morning as they were forcibly displaced from the hospital. About 30 individuals, including healthcare workers and patients, were moved to the Indonesian hospital, located nearby. However, that facility was heavily damaged by Israeli strikes last week, leaving it without water, electricity, or medicine. We understand that the Ministry of Health in Gaza and the WHO are currently attempting to negotiate with Israeli authorities to either repair the Indonesian hospital or secure the transfer of patients to a safer location. Kamal Adwan, meanwhile, has been effectively destroyed after enduring over 80 days of siege. The hospital faced sniper fire, shelling, and even explosives dropped by drones into its courtyard. Several Palestinian healthcare workers have been killed or injured. Now, as mentioned earlier, over 100 people, including Dr. Safia, have been forcibly detained, with reports suggesting he remains under arrest as of this morning. A WHO spokesperson described the situation for critically injured patients in Gaza as effectively a death sentence. Do you agree? I think that's not only accurate but perhaps understated. This has been a death sentence for Palestinians in Gaza for months now. Over the last 14 months, organizations such as Human Rights Watch, Amnesty International, and the UN Special Rapporteur have characterized the situation as genocide and ethnic cleansing. The deliberate targeting of healthcare facilities, workers, and infrastructure is part of a broader strategy. Kamal Adwan was the last functioning hospital in northern Gaza, an area where UN estimates suggest 75,000 people remain, living in fear, without access to basic necessities like healthcare, water, food, or medicine. The options left for them are bleak: to die, to be killed, or to be forcibly displaced to the south. Unfortunately, we'll have to leave it there. Dr. James Smith, thank you very much for sharing your insights with us.